All right. Good afternoon and good morning, depending on where you are in the country. I want to welcome you to the latest episode of St. Baldrick's Impact Series. My name is Katherine Lugar. I'm the chair of the board of St. Baldrick's, and I'm sitting in for our usual host, the CEO, Kathleen Reddy. I'm really excited about today's interview with Dr. Alex Huang, who is innovative and a highly accomplished childhood cancer researcher. He's the recipient of many St. Baldrick's grants and a tenured professor at Case Western Reserve University School of Medicine. Dr. Huang has dedicated his work to research immunology at a cellular and molecular level and has recently focused on creating immunotherapy clinical trials for sarcoma and other hard to treat childhood and adolescent cancers. Outside of the lab, Dr. Huang has supported St. Baldrick's by shaving every year since 2009, making him a knight commander in the St. Baldrick's League of Legendary Heroes. This year is no different. Dr. Huang is scheduled to shave again in just a few weeks in March for his 14th time. Please join me in welcoming Dr. Alex Huang.
Hi, Katherine.
Hello, good afternoon, Alex.
Hello.
We're really looking forward to today's conversation, but right off the bat, I want to say thank you for what you do in the medical field, and thank you for what you do for St. Baldrick's and really walking the walk. So, all right. So, as I said in your intro, you're a 14-year St. Baldrick's volunteer leader. This, of course, demonstrates incredible commitment to kids with cancer, but your commitment was actually forged much earlier in your life. Could you tell us a little bit about the loved ones who inspired your career path today?
Yeah, thank you, Katherine. So my story began really back in childhood when my cousin, I consider my best friend, growing up, actually passed away from osteosarcoma, and this was in 1979. And he was 12, I was 11. And in the same year, another one of my childhood close friends passed away from acute myelocytic leukemia, AML. So I lost two childhood friends in the same year. It was a very traumatic experience, but their passing fueled a lifelong passion for me to try to help and provide help and hope for childhood cancer patients and their families. So, and also I've experienced many family members who suffer from adult onset cancer. So it's personal experience, and these experiences, including my grandfather who died of prostate cancer, my two aunts who passed away from ovarian and pancreatic cancer. My own father actually is a survivor of colon cancer. So those are the events that really sort of shaped early on in my career to dedicate to researching cancer.
Well, thank you for what you do. Let me ask you a question going back to your cousin and your best friend. Had they been diagnosed today, would their treatment be different? And if so, how?
Yeah. So in terms of for my childhood friend who had the AML, I think over the past 30, 40 years, actually have been tremendous progress made in that regard, in terms of leukemia in general, but also ALLs and AMLs. And there are increasingly more options for children and adolescents who are afflicted with these. Obviously, the famous ones being CAR T cell for ALL, but there are also other antibody therapies, bone marrow transplantation, and others coming up that are really improving the outcome, although still not optimal in the case of AML. Certainly, for patients diagnosed with AML now, they have more options. But for other diseases like osteosarcoma, for example, then really over the last few years, there are some incremental advances, but overall, the efficacious therapeutics still has yet to really come about. And I would say that my cousin, who was treated back in the 78, 79, probably received the same combination chemotherapy, maybe a little bit dosing and scheduling, but pretty much the same drug as we are giving kids now in 2022. So I would like to change that therapeutic landscape somehow.
Absolutely. I know we're going to talk about that a little bit more as we continue forward. So the St. Baldrick's Foundation was really fortunate to meet you very early in your career when you had completed your fellowship meaning you were a doctor and a researcher, and you were, in fact, seeking funding for your first solo research project. What are some of the challenges that early scientists face in getting funding for their research? And talk to us a little bit about how St. Baldrick's helped you.
Yeah, that early transition from being a trainee as a pediatric hematologist oncologist or as a postdoctoral fellow where you are actually being monitored and supported in many ways by your laboratory mentor, to becoming an independent investigator. That is a very sort of dizzying, confusing time for any of us. And that challenge is not only because you're trying to take on an identity of your own, you're trying to establish yourself, your reputation. You are competing with other people, very talented people across the country, for funding that are able to sustain your research endeavors. But at the same time, as a physician scientist, you are trying to establish yourself as a clinician. You're trying to climb the academic ladder, right? Going through all the activities that relates to your promotion, and starting to be in the role of a teacher. So there are multiple hats that one wears, and very often we can only have 24/7. So there's a very sacred word in the academia world that's called protected time. And it is the time that you can use to be productive, not only to sustain your research, but also your own salary support and all the other things that comes on with it. So, and very often the way to do that quickly in the junior faculty level is you see patients and they generate clinical revenue that helps you deflate some of these costs, but it becomes sort of a vicious cycle that the more time you spend in the laboratory, the less time you have to see clinic patients, and vice versa. So the early support I received from St. Baldrick really provided that protected time, so I can really sort of focus a dedicated portion of my daily activity to really thinking about how to best establish research careers, mentor students, and think about issues that I would not have that time to really sort of devote to otherwise. So that protected time is truly crucial for any junior faculty. And I will also just say that even for senior faculty members, that they're really to be able to sit down and think critically and develop a more thoughtful approach to research. Those are just invaluable, assets to have.
Absolutely. Well, your Scholar Award was extended because your work was so promising. And I think it's really notable that you've competed for and received 4 other grants from St. Baldrick's. So among them, you were funded to create a tumor banking system for live brain tumor cells. And can you talk to us a little bit about what did that project make possible and how does it enable research to move more quickly?
Yeah, so I was very fortunate to receive an infrastructure grant from St. Baldrick's at one point, almost 10 years ago now. And that really catalyzed our institution's effort to sort of procure very precious, fresh pediatric tumor samples that came directly from the OR, and preserve and propagate these samples by passaging them in experimental models that does not rely on either freezing the cells or in some way destroy the content of the tumor. I mean, there are many things we can learn from the traditional methodologies where you actually freeze cells and you can learn from the genetic makeup or protein makeup, but there's nothing, it does not afford us an insight into how these tumor cells and their interaction with our tissue interact with one another in a preserved 3-dimensional space, and our ability to actually propagate these very precious tumor samples from our patients in a live setting really allow us now to really interrogate some of the other issues that we could not have done it before. And that is, for example, asking questions of whether the tumor will respond to immunotherapy or certain drugs within a living tissue organism rather than a plastic dish. And so these are all very important assets we're able to now procure. And because pediatric cancer is so rare, you wanted to capture as much information as possible.
Right. Really impressive. All right. So to the audience, if you're just joining us, we are talking with Dr. Alex Huang, a 14-year Shavy Knight and Commander, St. Baldrick's grant recipient and pediatric cancer research innovator. That's a long list of accomplishments, Dr. Huang. Dr. Huang is sharing with us some of his really remarkable work with St. Baldrick's, both in and out of the lab. All right, so let's go back to our questions, Alex. You were the first person to receive St. Baldrick's Innovation Award. Congratulations.
Thank you.
Your aim was to apply immunotherapy to brain tumors and other solid tumors. Why are brain tumors so fatal in children? And tell us more about why you're working so hard to use immunotherapy to treat them.
Yeah, so brain tumors in a child, collectively, brain tumors, obviously the many different kinds of tumors within that category, but as a category, it is the second highest incidence of childhood cancer besides leukemia. But in terms of mortality, is actually number one. So the brain of a child undergoes tremendous growth and change during early childhood. So any disruption to that process can be very detrimental. So even though you may not have what we call malignant brain tumor, meaning tumor that can go outside of the brain and metastasize elsewhere. But even the quote unquote benign tumor can cause a lot of problems. And because your brain is very limited in terms of space and is very delicate in all the areas that you occupy. So any therapy you attempt to remove either benign or malignant tumor by radiation or surgery can sometimes incur unacceptable side effects. So we've tried to figure out different ways by understanding different molecular pathways and targets and things like that to understand if there's anything we can do to enhance using immunotherapy as a weapon to fight cancer that will leave as little mark of damage to normal tissues as possible. And in that project, we're still working on it. And one area that we focus on primarily is in medulloblastoma. And we are continuing to work with industry partners to sort of testing new drugs that are coming up the market and for the efficacy in that disease. But it's a challenging tumor. It's a challenging class of tumors, and I think a lot more work needs to be done in that area for sure.
Absolutely. Well, I guess speaking of challenging tumors and challenging classes of tumors, you were also the recipient of a special grant to develop a more effective treatment for kids with relapsed osteosarcoma, bone cancer. Like you, this one is really near and dear to my heart. It's actually the reason why I got involved with St. Baldrick's. My sister's daughter, Caroline Richards, was diagnosed at the age of 11, passed away at the age of 12, just like your cousin. And Alex, I'm going to guess that she largely received the same very outdated chemotherapy treatments and regimen, again, with some of the changes you referenced, some 30 years later when she was sick. And of course, like your cousin, those options didn't work for her. I was really moved when in our own community here in Washington, D.C. and the Northern Virginia area, dear friends of ours, Michael and April Egge, and their daughter, Olivia Egge, was also diagnosed with osteosarcoma a couple of years after Caroline. And we then found a whole community here that had been touched by the disease. It was great. We came together and we decided that we needed to really raise money to fund research with scale. Yeah. And so put together the first osteosarcoma RFA special grant that you were ultimately the recipient of in a really competitive process. So talk to us a little bit about what made your research revolutionary and why is taking risks in medical research so necessary?
Yeah, so I'll just speak to osteosarcoma. Obviously, it's a daunting challenge, and that among other sarcomas, and it is diseases that we have tried for multiple decades now, trying to tweak here and tweak there, different ways of giving same drugs, different combos, intensities, and things like that. But it remains to be a challenge. And so at some point, I sort of, my approach to it is that we got to bring outside of the box. You got to be multi-pronged. You just got to throw the kitchen sink at this, right? And as an immunologist, obviously I was sold early on in my career on the power of immunological principles and how that can cut across multiple disease barriers, and not just in cancer, but this sort of the concept of healing within, and that regardless of the particular genetic causes of a cancer, ultimately your body's immune system has to react to that reality, and it develops a way to cope with it. And in that interaction between the immune system and osteosarcoma in this case, there are things where the tumors coach the immune system to sort of became an enabler, but now we are beginning to understand a bit more about the science underneath that, and it opens up the opportunity for us to say, okay, we can actually co-opt that interactions and then somehow use the immune system to fight against cancer. And so it's a thinking process that we sort of turn around, rather than thinking about the tumor itself and studying the tumor, but we are studying outside of the tumor and see what happens. And fortunately, through the innovation and also through the Osteosarcoma Collaborative Impact Grant, we're able to now understand and actually develop from bench to bedside at least 3 clinical trial concepts. They are the proof of principle concepts where we can either take already FDA approved medications. They were designed to target the immune system in a different disease, but now sort of turning upside down and say, okay, can we try this in a disease such as osteosarcoma? Or in other 2 or 3 trials that we're trying to come up with, is to take concepts that are already proven in the adult cancer world and apply it in the osteosarcoma, because again, I said the immunotherapy really sometimes can cut across multiple histologies, adults and pediatrics. So really the whole collaborative and St. Baldrick's collaborative impact is quite tremendous. That allows us now to really kind of flourish and provide new immunotherapy mediated concepts for osteo. Remains to be seen if it works, but I think at least it's worth a try, and we'll see how things go.
Well, we're not going to make it better for other kids if we don't have the funding and the research, right, to find better and more effective cures. And you referenced the fact that you've started multiple clinical trials and received orphan drug designation for, I'm going to say it wrong, bactericeb. I totally assaulted. Yeah. Tell us about how you're going to build upon these successes for kids with osteosarcoma. Is there anything else you would add to what you said earlier?
Yeah, so there are several things. We're approaching, obviously, we want to understand the science. We want to see if there are available drugs out there that's readily translatable. And part of the challenge also was to have the conversation, convince the industry partners that they have medications in their arsenal that can be used to fight pediatric cancer, but you need somebody to tell them how or in what setting and engage in that conversation. So we've been very fortunate to form a very strong collaboration with Mepecto that's based in South Korea, and now they have a North American presence who develop a oral small molecule that target the TGF-beta pathway, which is very important in not just osteosarcoma, in multiple cancers. And they have very good track record in terms of toxicity of that drug in adult cancer trial in combination with immunotherapy and others. And we've been able to, over the last couple of years, engage them, actually show them data in preclinical osteosarcoma model that their drug actually works like gangbusters in some of our preclinical models. And as a result, we are able to talk to them and to think about osteosarcoma as a disease that they can go after in terms of their market. And so we're able to help them with the orphan drug designation just this past August. And we're talking to them now about the concept and what it would look like to be for phase 1 clinical trial. And that was just one of multiple examples that we have our in-house pharmaceuticals that we're trying to develop. And it also has received orphan drug designation as well as a rare disease designation from the FDA. using the outer component of oat brand that is the brainchild of Dr. Mei Zhang in biomedical engineer. So it is really the concept that this is child cancer is a team sport. You just gotta engage everybody, and industry and other interdisciplinary investigators and collaborators. We just all gonna work together to do that. So yeah, it's very exciting.
It is very exciting, and thank you for what you're doing. Really, I think it's really promising. So,
thank you.
Well, our audience, or actually, let me just simply say, I think a lot of people look at the dollars invested in medical research, and they automatically assume that childhood cancer gets a big share of it. Because who doesn't want to cure kids with cancer, right? But you and I both know the reality is quite different. So why do you urge people to dig deep and to fund pediatric cancer research specifically? And what progress can we reasonably expect?
Yeah, I think so despite their yearly huge investments from the federal government, both NIH, Department of Defense, and but the reality is, I think more than 90% of all the cancer funding, cancer-related funding, really are geared towards adult cancers, and I think it makes sort of economic and population case because of the sheer number of patients who, for example, with breast cancer and colon and lung cancer, and so the pediatric cancer is labeled as rare, but it is not so rare. And so, but historically, it has not received sort of the attention that, thankfully, we're seeing signs that thanks in large part to all the supporters of St. Baldrick's and many other foundations in childhood cancer, are sort of grassroots from the bottom up, affecting policy making decisions and at the Capitol, right? And so it's really exciting to see, but because of that, I think we, rather than waiting for the government and other big agencies to sort of focus on your involvement, and folks listening to this, their voice, voting with their wallets and voting with their head shaving, whatever, makes a huge difference, because it is bringing attention to this important issue through your advocacy, that we can get more people involved. And so I'm very obviously very grateful. St. Baldrick is also involved in passing legislation like the PACT Act and CARE Act and all these important
Act, yes.
Yeah. So the more the merrier, and we just need to bring the very best people into this research and advocacy and policy making and everything else to really sort of make an impact, and soon, quickly.
Absolutely. Frankly, it takes all of us, right? Yeah. All of us doing our part, giving our money, working with government, and having a really holistic solution. So our audience likely knows that head shavings are the foundation's bread and butter. At these events, volunteers raise funds from family and friends to be shaved bald, standing in solidarity with the kids who have lost their hair during treatment. My husband has done it. Our son has done it. My father has shaved his head. And Alex, you have, as I mentioned, shaved your head 14 consecutive years. As a result, you have been knighted by St. Baldrick's and subsequently elevated to the rank of Knight Commander in our League of Legendary Heroes. So congratulations.
Thank you.
When you look at the entirety of your life, which already has been dedicated to kids with cancer, why is it so important for you to continue doing this each year?
Yeah, so we obviously work to solve problems in childhood cancer through research, but it's always a good reminder, reminding ourselves and folks that I have the privilege of working with on a daily basis in the laboratory, in the clinical space. Sometimes, once in a while, we lose sight of why we do what we do, right? In the morning, we kind of get up and we just go through the routine, and you forget that at the end of our efforts in the laboratory or in the clinical space, there's a family and a child out there that whose life we can really have a tremendous impact. And so it's good to kind of rededicate our efforts and determination on an annual basis. And really, I think all the head shaving events, above all, for me personally, is really an engagement with our community and the patients and their families and our colleagues, nurses, pharmacists, and everybody who really had a part in if you think about if you have experienced childhood cancer, the family of people that surround you, it's a community. And so it's a great event for me to sort of at least reminding myself that I am just one piece of this greater puzzle that we all need to come together. And I think it's, like I said, it's a team sport. And if I can be there to help and rally the troops, that's my privilege. So
well, I can only imagine the kids that you're working with, how proud they are to see you standing there with them, right?
Well,
and
I
doing your part in the community.
And many of our students actually and trainees all shave their heads, and just for full disclosure, I never coerce them to do it. I think,
but sometimes they might be strongly encouraged, maybe.
They're strongly encouraged. But even if they don't shave their head, I mean, they're all involved. People have bake sales, and they do all kinds of whatever it is to help. And really, it's a community event. It brings you together to say, okay, you are not alone.
Exactly.
If you're diagnosed with cancer, if your child is diagnosed with cancer, you are not alone. We are here for you, and we hear you, and we feel for you. So, and we'll do whatever we can to help.
And frankly, that's what we found with our events too, especially for the kids that are currently going through fights, to walk in and to see a community come together,
Yep.
to see people get in a chair and shave their heads, and to see others who are so inspired get up in the chair, maybe if they weren't planning on it, and shave their heads. It's a pretty magical thing.
Sometimes they can be so inspired they shave their eyebrows too. So that's a whole different story.
Oh my goodness, we might have to wind up with that one. Alex, it's really impressive, and I think it's notable, is that between your shaves and the events you've led, you've raised almost $45,000 for life-saving research. You've already talked about this, but why is it important that you raise funds to help support other researchers' work, right? This money doesn't necessarily go to your work. In many cases, you're supporting your colleagues.
As I said already multiple times, I think solving kids' cancer is a team sport. And there are many talented people in the scientific community whose expertise can be combined to tackle this critical problem if we all work together. I mean, we've seen it. We've seen how we tackle, COVID-19. And when you have the scientific community and the will on the political class and the community to come together, you can have a vaccine in 8 months, right? I mean, that concept should be applied to pediatric cancer. And so I want my research colleagues to devote their talent and energy to contribute to this effort. And I'm confident about myself enough to say I'm not the brightest light bulb in the room. They are brighter people than me. And if my effort can help them achieve the next sort of breakthrough, so some other children and their families can have that hope, that's what I'm going to do. So so we know that money we raise, most of them will never come back to our community, but you will go to be in good use and facilitate our research efforts and all the efforts that we do together. So that's why it's so important, and I want the team to be able to have a transformative discoveries to and turn them into fruition. So that's what I do.
Well, as I said earlier, Dr. Huang, you don't just talk the talk, you walk the walk. Thank you. You are an absolute inspiration. And I just want to say thank you for filling in me and our audience today on some of the really exciting and promising work that you're doing. But also thank you for what you do personally to support St. Baldrick's and the broader medical and cancer community. It's been a real pleasure spending time with you today, but also a pleasure working with you prior to today in your osteosarcoma research.
But Katherine, last thing I'll say is that I think St. Baldrick's play a huge part in my professional development. And it's just, it's hard to imagine what my career would have looked like without the involvement and the support of St. Baldrick's and folks that are seeing this program. So thank you. And just remember, you may not be holding a pipette, but through your actions and your support, you are there. You're there with us, and you're part of what makes the innovations possible. So thank you very much.
Absolutely. Thank you. And also I want to say thank you to our audience for tuning in today. I hope that you'll mark your calendar for February 25th at 1 p.m. Pacific, 4 p.m. Eastern, when we speak with St. Baldrick's event organizer, Shavy, and recent college graduate, Nick Mondisic. Until then, I want to say thank you to all of you for helping to give kids a lifeline. So thank you.
Thank you.
Take care.
Take care.